Well, there is another cost of living blow for Australian families this morning, with health insurance premiums due for the largest rise in nearly a decade. The government says the increase reflects the growing costs of medical and hospital services.
More than 15 million Aussies are set to take a hit to their hip pocket, with private health insurance set to rise. From April 1, premiums will jump by an average of 4.41%, the biggest hike in almost a decade.
Many Australians are rethinking their private health insurance following news of the biggest hike to premiums in almost a decade.
Premiums expected to rise around 5% from April 1, the biggest increase in years. For the average combined hospital and extras policy, that's about $175 more per year.
Good afternoon. Many Australians might be reconsidering their private health insurance after the federal government approved a premium increase of 4.41%.
Doctors say the cost of providing healthcare is growing as the government pushes for more GPs to offer free care to patients. A new report shows only 12% of GPs bulk bill all of their patients.
Right. Here is what the health funds and the government that signs off on them would rather you did not sit down and work out. From the 1st of April, a family holding an average gold hospital policy is paying about $330 a year more than they were paying in March. A single person, somewhere between $59 and $167. That is not a forecast, it is not a warning, and it is not something you get to vote on. 15 million Australians are paying it.
It means a family with an average-priced gold hospital policy could pay $330 more annually. Those with silver cover face an increase of $166, while bronze policies are expected to rise by $120.
The increase is 4.41%, the largest in 9 years, above inflation, and approved by the Health Minister, Mark Butler, before it landed in your account. That is the average, and the average does the least work. The 4 biggest funds, the ones most of you are with, did not take it. NIB went to 5.47%, Medibank 5.1%, Bupa 4.8%. 8 in 10 policies sit with the 5 largest funds, so for most of you, the real number is not 4.41 at all. Choice published every fund's increase side by side, from GMHBA at 1.98% up past the Big Four. Same industry, same year, 3 times the difference depending on whose name is on your card. And here is the part that should make your blood boil, because it is not the small print, it is the whole design.
Yeah, that's the real myth. A lot of people think, oh, why do I have to check my private health insurance? Excuse me, because they're all going up the same amount. They're not. The Big Four, they're going up 5.5%. I think the biggest increase is almost 6%, but there are some only going up 1.9%.
So you pay more. The question nobody in that announcement answered is what you are paying more for. Because a premium is not a service. It is a promise that on the day something goes badly wrong, the bill will not be yours. And the entire value of that promise sits in a document most people have never read to the end. Trevor and Marie Cox read theirs on the drive to hospital.
On the drive to hospital, they learned Bupa wouldn't pay, so they borrowed $30,000 off friends.
And then we had to remortgage our house to pay everyone back.
Oh, so there you are.
It was just cruel. I'm just a little fish and, they make so much money.
$30,000 borrowed from friends and then a mortgage put back on a house that was very likely paid off by 2 people who had been paying premiums for decades and had every reason to believe they were covered. Marie slipped on a nature strip. She needed a shoulder replacement. Joint replacements had been taken off their policy. They are not an outlier. 360,000 Australians have dropped gold-level cover in 5 years as the price ran away from them. When people leave gold, they do not leave insurance. They move to silver or bronze, and those are defined by what they do not pay for.
If you're taking silver or bronze level, the health insurer is still making a monster off the back of your premiums, right? But if you do get sick, there's a whole list of exclusions that they don't have to pay for.
We have here what we're not covered for.
Their new Silver Plus policy also didn't have accident inclusion cover, which could have kicked in.
The price goes up in April. You cannot absorb it, so you ring the fund. The fund does not lose you. It moves you down a tier. Your cost stops climbing. Your exclusions quietly get longer. An exclusion means you agreed not to be covered at all. A restriction means only limited benefits, in return for a lower premium. In the 6 months to the 30th of June, more than 246,000 policies were downgraded. Upgrades used to outnumber downgrades. That has flipped. And a nationally representative survey found 46% of policyholders planned to cancel, downgrade, switch funds, or lift their excess. 19% said they would drop hospital or extras cover outright. Now hold that against the top of the market.
So which is good, the privatehealth.gov.au, it shows that for a gold hospital cover for a family, it can cost up to $17,000 a year. So that's crazy. How can someone afford that? And that's the problem.
How often are they using it? So these insurance companies are just making profit after profit after profit.
$17,000 a year from a household that also pays the Medicare levy and every specialist gap. The industry says costs went up. They did. Here is what sits beside it. Over 5 years to June 2024, industry profits rose 48% and the sector made $2.7 billion. The year private hospitals lost $756 million. The Australia Institute put Medibank's return on equity at 45%, Bupa's 34% and NIB's 40%. The money is not disappearing into the hospitals. Some of it is stopping on the way. And here is the bit that really stings. Over 16 years, premiums roughly doubled, while the price of health services rose about 20%. And the cover is not exactly the same, which is the point of the last 10 minutes. Listen to how the reporter frames the scale of it.
Well, Bridget, for the 15 million Australians that have some form of private health insurance, they're going to be forking out an extra 4.41%. That is the biggest price hike that we have seen since 2017 and is, of course, above the rate of inflation.
Now widen it out, because private cover is only one of the 3 bills coming at you, and the other 2 are getting worse at the same time. Australians spent $44 billion out of their own pockets on health in 2023-24. Per person, that is $1,636 a year, and that is the average, which means for anyone with a chronic condition, it is dramatically more. No premium covers that. Private health insurers are legally not permitted to cover out-of-hospital Medicare services at all. Then there is the front door of the whole system.
Yes, good afternoon. Well, the big message here is that while most Australians can still get in to see a GP, the rising cost of care is hitting harder. Almost 9% of people delayed seeing a doctor last year because of money, with the average gap fee now almost $40. That's according to a new report by the peak group representing general practitioners.
Almost 9% of people put off seeing a doctor last year over money. Only about 12% of GPs bulk bill every patient. 4 in 10 bulk bill few or none. The average gap is now close to $40 before you have filled a prescription or seen anyone with a specialty. For a household on a fixed income, $40 is the difference between going and not going. And not going is the most expensive decision in the entire system, because everything found late costs more to the patient and to the hospital that eventually gets them.
The growing number of patients are forced to pay out of pocket for GP visits. A majority of Australians say their medical expenses have increased this year, with more than half delaying or cancelling appointments.
More than half. Delaying or cancelling appointments, not luxuries, appointments. And it does not fall evenly inside a household. Finder's 2026 health survey of 1,010 Australians found 28% of women had gone without care because of cost, against 17% of men, and that 1/3 of women now hold no cover at all. And it very rarely arrives as a decision. It arrives as a surprise at a reception desk you have stood at for years.
When I went to go leave, they told me that there was a cost, and I was quite shocked.
With appointments now costing up to $80.
Really?
She says her son's fortnightly visits add more pressure to the family budget.
6 years with the same doctor, and the cost arrives without a letter. Now put those 3 bills together, the premium, the gap, the medicines, and put them on a household that is not earning any more this year than last year.
Pensioner Jennifer Scatini has budgeted her weekly shop down to the last dollar.
I buy about 2 or 3 pieces of fruit, and that's all I can afford.
The 73-year-old who lives on the coast south of Perth was already struggling to make ends meet living on the pension.
2 or 3 pieces of fruit. That is the budget the next paragraph lands on. Because there is one more moving part almost nobody has priced in. The government pays part of your premium back to you. It is called the rebate, and it depends on your income and, until now, your age. Under 65, you get about 24% back. At 65, 28. At 70, just over 32. In the April budget, the government confirmed it is removing those 2 higher age tiers from the 1st of April 2027. The government's own estimate is between $226 and $255 a year. The fund's modelling says someone over 70 on a gold policy could be more than $1,600 worse off. Around 3 million Australians are in that bracket, and roughly 70% of insured over 65s earn $55,000 a year or less. The fund's own peak body has put its forecast in writing. Tens of thousands of older Australians dropping cover and hundreds of thousands downgrading. Read that again, and read it as a precedent, not a policy. Whatever you think about whether that group should get extra help, what just happened applies to everybody. The discount you have been quietly relying on is not a fixture. It is a line in a budget, and it can be removed in an afternoon. The over 65s went first. They will not be the last, and nothing in the design of this system requires anyone to warn you before your turn.
At 72 and largely immobile, Philip Hodge needs hired help to shower, but tough times have meant tough changes to his hygiene routine, now limited to just 1 shower a week.
It lowers your self-esteem. It does, to start with.
That is what it looks like when a support payment is retuned in Canberra. Not a headline, a shower once a week. And that is the answer to the question everyone asks. Why do you keep paying? Because the alternative is a public waiting list. Because more than 70% of surgery here happens in private hospitals. And because the day you drop cover, you start accruing a 2% loading for every year you were over 30 and uninsured. And because above a certain income, walking away costs you anyway. The Medicare levy surcharge runs to around $1,500 a year for higher earners without private hospital cover. For a large slice of the market, the cheapest policy on the shelf is not bought for the cover at all. It is bought to avoid a tax. You are not being persuaded to stay. You are being held. So where does this end? 3 scenarios, and only one is comfortable. The best case. The reform package works. Device prices get cut toward New Zealand benchmarks. The funds themselves say common devices cost 30 to 100% more here, and alignment alone could save $300 million a year. Claims costs stabilise, and the annual rise falls back near inflation. The realistic case. The rises keep running ahead of wages, and the downgrade machine keeps working. Hospital cover is now at 45.6% of the population, extras at 55.5%, both falling since 2023. The product stays and quietly stops being insurance. The rebate change goes through. Older members leave in the numbers the funds are forecasting, and the remaining pool gets older and sicker, which pushes next year's approved rise higher, which pushes more people out. 16 years of doubling premiums against a 20% rise in the price of care is the Australian Medical Association's own comparison. And it is the clearest statement anyone in the sector has put on the record about where that ends. The people it strands are not the wealthy. They are the households already paying $17,000 and wondering how often they actually use it. And the tier most exposed is the one people bought for peace of mind.
You can see the highest was 9.56.
It's a lot.
It is, but remember, these are averages too. Some of them, like your gold policies, jump double digits.
These guys, this is just ridiculous. This makes me so angry.
We didn't ask to get old and go on the age pension. I'd like to go out once a week, go to a cafe and have a coffee and toasted sandwich or something. But you go and get a loaf of bread and come home and make your own toasted sandwiches and your cup of coffee.
Here is what nobody says out loud when the April letter arrives. None of this was weather. Every premium rise is submitted by an insurer, assessed by the regulator, and signed by the health minister, who must approve it unless it is against the public interest. So somebody looked at 4.41%. In a year, the sector made $2.7 billion and decided that was in your interest. And when that government wanted savings, it did not look in the $2.7 billion. It went to the rebate paid to people over 65, with the money redirected to aged care beds. That is the answer to the question this whole video has been holding back. You have paid every premium on time for 30 years, and you can still walk out of a hospital owing $30,000. Not because your fund made a mistake, but because the exclusion was written in deliberately. The tier was downgraded by design, and every increase that pushed you into it was approved in writing by a minister. And the government's own page on out-of-pocket costs states the rule plainly. Private health insurers cannot cover out-of-hospital Medicare services, and doctors sometimes split bills to work around the gap cover agreements they signed. The funds built the product. The government signed the price. You paid for both. So, 5 things. Do the first this week because it has a deadline. 1. Read your exclusions before you need them. Log in and find the page headed What You Are Not Covered For. Look for joint replacements, cataracts, heart procedures, and accident cover. If joint replacements are not there, you are one fall away from the Cox family's position. 2. Prepay before the 1st of April. Pay 12 months up front before the increase applies, and you lock the old rate for a year. On a family gold policy that is about $330 kept for a phone call. 3. Check what your fund actually did, not what was announced. 4.41 was the weighted average. NIB went to 5.47. Check your letter against the government's own site, privatehealth.gov.au. 4. Switch without fear of the waiting periods. The main reason people stay on a bad policy is believing they must serve them again. On equivalent or lower cover, your insurer is legally required to recognise the periods you have served. Downgrading also avoids the 2% lifetime loading that cancelling triggers. 5. If you are over 65, or will be before April 2027, price it now. Work out what your premium looks like with 4 to 8 percentage points less rebate, and decide whether that policy is worth holding while you still have a choice. 15 million people are paying more for a promise that has been getting quietly narrower for 16 years. The premiums doubled. The list of what is covered did not. 360,000 households have stepped down from gold. The funds made $2.7 billion. The rebate for the oldest members is being withdrawn. Every one of those decisions was made by somebody in a building with a signature on it. None of them were made by you. All of them are being paid for by you. So tell me this, and be specific, because I read them. What did your fund actually put your premium up by this year? And when you looked at the letter, did you cover it or did you downgrade?